Well, good afternoon, everybody, and welcome to Cattle HQ Live, a webinar series brought to you by South Dakota State University Extension. My name is Erin DeHaan, and I'm one of the co-hosts for the Cattle HQ Live webinar series. Today, we have Dr. Jessica Drum, our SDSU Extension Beef Reproductive Physiology Specialist, discussing pregnancy detection methods and timing. As a reminder, if you have any questions throughout the presentation, please go ahead and drop them into our Q&A or chat feature, and we will address those questions at the end. I will now turn things over to Jessica.
Good afternoon, everybody. It is a pleasure to be here once more to talk about one of my favorite topics in reproduction, the pregnancy detection. So I'll share my screen here so we can get going. So here we are. So for starters, I want to show you my my outline, what we're going to talk about today. So we're going to start talking overall how is the current use of pregnancy diagnosis around the US and the impact of that. Some decisions that you can make, some information that you can have out of that pregnancy diagnostics techniques. And we're going to go into the methods, the potential methods that can be used, divided in direct and indirect methods. I'm going to talk about the pros and cons of both of them. And we're going to, at the end, we're going to finish with the factors to consider when we are choosing the right method for us. So to start, I would like to ask a question to everyone in the audience. Andy, can you please put it on the poll? Please answer. My question is, Candy? My question is, do you currently use any pregnancy detection method in your farm operation? I'll give you a few seconds for you guys to answer. So as I expected, we have a majority of people that currently use for pregnancy detection, any sort of pregnancy detection method, which, why do I say that I expected that? Because you would assume that a person that is looking for information on pregnancy detection already is familiar with the methods. So our audience is a little bit biased at this point. So regardless of your point of view, we're going to talk about the methods that are available. I'm going to anticipate that I'm not going to tell you which one is better, which one I prefer. I'm going to tell you what are the options, and then you can make your own decisions based on what you expect. When I say that this audience is biased, is because when you look at the current situation in US, only about 20% of the beef cattle operations undergo use pregnancy diagnostics each year. And this is the data from USDA 2011 from a report from small scale US farms. In looking into that, when the farms are divided by herd size, the biggest the farms with 200 or more animals, the more people are willing to use the pregnancy detection. But when you look at these smaller farms, less than 100 cows per farm, we have some reasons why they are not using those techniques. Only 1% thinks that it doesn't work. The majority of the reasons include labor and time. People think it's too much work and too much time to implement that. The cost is our second most voted reason, and then we come facilities and too difficult to complicate in third place. So we're going to talk about the methods, and then you can make your own conclusions based on that, what you think it is. The reason why you wouldn't use or people would not use. But we're going to show you that there are options for all of those reasons. Other reasons that are not listed here come to 14%. So just to make a quick calculation here, I am not an economist. I'm just making calculations based on values that are available online, available on SDSU extension website. So if you look at an average herd with 15 breeding age cows, with roughly 5% of them that do not get pregnant each year, that's based on real numbers. Around 10% of the cows do not get pregnant at the end of breeding season overall. So if you have 50 of them, 5 of them would be open, okay? So if you consider the cost per head of $863 per cow, based on a publication from Dr. Warren Rush from SDSU, and considering a calf revenue average of $1,300 per calf at this price, we expect to need $4,300 to maintain these 5 open cows. In addition to that, plus the cost of the calf revenue that you lose, which is $6,600. In total, the producer is estimated to pay $10,000, almost $11,000 for only 5 open cows in their herd. So that's a cost that is not easy to get when you think about a farm operation with such a small margin of profit. So what other return the pregnancy diagnostics can give you other than the economics? So the economics, we know we are covered. We don't want to lose $10,000, right? So we're going to go over what kind of things that pregnancy diagnostics can give you. I think overall information is the most valuable thing that pregnancy diagnostics can give you. First, you can measure the reproductive outcomes. So the fertility of your herd. You can know if your cows are actually giving 1 calf per year, as ideally you'd have. You can determine if your synchronization or reproductive practices are being effective. For example, you can evaluate your synchronization effect if you use them, or if your heat detection is properly done. And with that, you can make decisions based on that, on those answers, and move on and change or even optimize those techniques. You have time. If you do early detection, you have time to intervene. Let's say you tank on your first synchronization. If you check right away, if you detect the pregnancies right away, as soon as you can resynchronize if that comes to that, or put the bulls earlier and be on top of the reproduction system. In addition, those informations can give you decision-making tools. You can decide what you're going to do with those animals, those open cows. You can resynchronize, you can send them to the sale barn, you can sell them to your neighbor, you can put them in the feedlot, you can do whatever you decide with those animals that are not pregnant, okay? So thinking about the encouragement of the economic gain, early pregnancy detection is going to identify the open females and give opportunity to intervene. Like I said before, resynchronization and AI, again, to maximize your number of AI pregnancies, which is very well established, that will give you more profit later. You can cull the open females sooner and stop spending money on their maintenance, stop spending money on food. That is the most expensive part of raising or keeping a cow. Other economic benefits are you have calves, having these AI calves make them older and heavier at weaning, which translate in more profit. You reduce financial stress on keeping the open females. And again, like I said in the previous slide, the cost to keep a female calf is estimated to be around $900 a year. It can be even more depending on the economic situation that the production is. So among the types of pregnancy detection, we have the direct methods and the indirect methods. So the direct methods are methods that detect directly, like the name said, directly the pregnancy. So it detects tissue, fluids, and the fetus. And the indirect methods, they detect markers for pregnancy. It's not going to detect directly the pregnancy, but other factors. We're going to talk about each one of those later on in this presentation. But the goal of any of those, all of those pregnancy detection methods is to obtain high sensitivity, high specificity, and be simple and inexpensive. High sensitive means that they can detect pregnancies. They can detect positive answers, so they can accurately say when a cow is pregnant. The specificity tells you that they can accurately detect when a cow is open. So you want both. You want to detect the open ones and you want to detect the pregnant ones, okay? So some examples we have here that we're going to talk about. The most simple one would be just wait for calving. So you breed them, pray that they're going to be pregnant. Next year, you see if they calve or not. That would be the simplest one, okay? Other direct methods, palpation. A veterinarian can go and palpate to detect the pregnancy itself. Ultrasonography is also another one that detects the actual pregnancy. And when you look at the indirect methods, the simplest one would be just detect the return to estrus. So you check cows in heat right after insemination, few days after insemination, start to heat detecting. The ones that do not come back in heat, you consider pregnant. The ones that do not come back in, the ones that come back in heat, open, and then it can be rebred. Another options are color Doppler. We're going to talk in details later, and blood tests. Just like in humans, you can get a blood sample from the female and get a pregnancy test. Okay, we're going to talk about specifics of each one of those. So to start with the direct methods, transrectal pipe, we talked about the calving one. Is pretty simple, don't need to go into it. The problems are you don't have an early detection. You don't know which one's not pregnant early on, so you lose all of that information and economic gain that you could have by early detecting. So the second one, direct, would be the transrectal palpation. It is the most commonly used technique. It detects basically the changes in the reproductive tract. So it changes the size, the location, and the contents. So contents like presence of fluid, the membranes, the placental membranes, and even in advanced pregnancy, you can detect placentomes. So it's usually done after 40 days by trained technicians. Before that, it can be done. There are people arguing that they can do up to 30, 35 days, but the incidence of false positives or false negatives is high, not only because it's hard to detect, but also because cows can lose pregnancies earlier than that. And by palpating, you can even improve, depending on the skill level, you can even improve those pregnancy losses. You can increase those pregnancy losses, and that's something that we don't want to. It's a minimal equipment technique, so you need a hand and a trained technician. You need facilities, obviously, because nobody's going to palpate cows in the with a minimum security or contained. Otherwise, the cow is not going to let you do it. But it's a merely yes or no diagnostics. It tells you if it's pregnant or not. Age of pregnancy can be estimated, but it's more broad. So it makes it hard, for example, to determine which ones is AI, which one is bull-bred when you have like a small window between those two breedings. So it's basically, if you look at this figure over here, you can see it's basically directly detecting the content of the fluid, of the uterus. So here we have a picture of what you expect around 70 days of pregnancy. The uterus should be in the cavity still. Here on the top right, we have examples of two uterine tracts, one from heifers, another one from cows, from mature cow. You see the differences in the size over here. Mature cows have naturally larger uterus, so that is important when you're training, when the technician is training, to know how to detect that this is not a pregnancy, it's just a mature cow that has a big uterus. So when you look at early on, this is a 60 days, 40 to 90 days of gestation. You see that there is like this, this is an open uterus. You see like the symmetry of the horns, and then you can detect the pregnancy by feeling that lack of symmetry on the horn. So this is a way of detecting early on from 40 to 60 days, 90 days. And here is after on the right, on the figure B, you can see how the placentomes look like, and you can feel those little balls when you palpate, and that's an indication of an advanced pregnancy. So here you see on this other figure on the left, you see the 70 days pregnancy should be in the cavity, and you will see only an asymmetry. You feel only an asymmetry. 90 days, the same thing, a little longer in the cavity. And after 110 days, this uterus start getting heavy with this grown fetus, and it goes down in the cavity. So again, making sure that that the location is being considered in addition to the size and volume of the liquid inside. Other technique, direct technique, is the ultrasonography. Ultrasonography utilizes equipment like this. This is an example of an ultrasound. There are many in the market. This is just an example. Usually is done with this rectal linear probe for cows. This convex probe over here can be used for sheep and other species. Even humans use convex probe. But in cattle, for transrectal ultrasound, we use the linear probe. Basically, this transducer, this probe over here, we see a close picture on the left, down left, and it has some crystals inside of this probe, piezoelectric crystals. This word is a mouthful. So these crystals, they shake inside, forming these sound waves that cannot be listened by humans, but they emit the sound waves that when they hit the structures, they bounce back to the machine, and the machine detects the intensity of those waves. So if you have more sound waves returning, if it bounces back more, you have a more dense material, such as the bone. So then when you look at the ultrasound image like that, you see like gray and white. It means more dense tissue. So like, for example, here is the fetus in the center. You see a very white structure in the fetus, probably are the bones of this fetus being developed and showing on the screen. So here, basically, you have to have a machine to do it, and it requires a trained technician. So the information that you can have from this data is you can have the pregnancy status as early as 25 days. So 25 days, you can detect the pregnancy, but there's still a risk of pregnancy loss. So it's recommended to do at least 30 days. We can estimate accurately the fetal sex and age, so you can differentiate between AI and bull bred easily. Uterine evaluation as well. You can gather information. Let's say you see a pregnancy that is it's not looking good, so you don't see a heartbeat on the fetus. You don't see you see the cloudy liquid. You can have information on this potential issues with that pregnancy. In addition to that, you can see inflammation. For example, if a cow has an inflammation in the uterus, you see content that is not equivalent to a pregnancy, and that gives you an information on the status of that animal. You can also follow through with the ovarian function to know if this cow is cycling, if this animal is capable of actually developing a pregnancy by this evaluation. And you can use the color Doppler. We're going to talk about color Doppler at the end, but color Doppler is also done by ultrasonography. That is an indirect method. So here are some examples of structures that you can see in the uterus. Embryo, you see here the uterus, the liquid in black, and the little fetus inside. In advanced pregnancy, you can see the placentome, this round stuff over here. You can see parts of the fetus, such as the ribs, in advanced pregnancy. So you can have a lot of that information by utilizing this structure. And here on the right, you have the ovary with the follicles. over here too. So you can evaluate all of those things. Just to give you examples of what you see, in an open uterus, you see no liquid inside. So you see the uterus very close, just the tissue. Over here, you have two examples. On day 30, on day 25, you should be able to see liquid, but it's still hard to detect the actual embryo, which that what gives you some room for making mistakes and detecting a pregnancy that potentially might be lost until day 30. So it's not the best time to do it. But if you look at day 30, you already can see the fetus. And here is a video of, if I can detect it, here's a day 32. We have a pregnancy here with the fetus inside, and you can even see a heartbeat. I am trying to, there's a video in here. Let me see if I can show you. Here, you can see the fetus inside and the heartbeat going inside. So you can tell that is a viable pregnancy. So moving on day 40, which is the time that you can detect by palpation as well, you already see a complete formed embryo. On day 60 and day 40 over here on the top, day 60, it looks like this outside of the uterus, and the fetus looks like this inside of the uterus with the ultrasound. So it's pretty clear how the pregnancy is at this point. There are other tools that can help technicians to learn how to detect these different ages. This is a table that you can punch into the ultrasound and measure them and if you measure the trunk diameter of the fetus, which is like the space between the ribs, the brain case, crown rump, or head length, you can estimate the age very accurately. So this is a thing that you can punch into the ultrasound and let it set settings saved and use as you go for the preg check. So the technicians can use these strategies to be more accurate. In addition to that, you can use for fetal sexing, so you can determine if it's a male or female after 55 days of pregnancy. So in dairy is a little less than from 55 to 90 because of the size of the uterus. From beef, 55 to 110. On average, people do between 60 and 80 days after AI. And at this point, what is detected is a genital tubercle. So the genital tubercle is this structure over here. This is a male fetus, so you detect it behind the umbilical cord, like in the belly. This fetus is a belly. It's the belly towards us. And here is a female. You see the hind limbs over here. And you're seeing an image from behind, so you see the genital tubercle from behind. So this requires a little bit of training from the vet, but is a very important information that can be done with the ultrasound too. In addition, the ultrasound for ovarian scans, like I mentioned before, you can find if this animal is cycling by detecting a corpus luteum here, or determine if they have a cyst or something like that that is impeding them from cycling. So that's a good information to have as well. So the pros and cons of the transrectal ultrasound. So it does require skill, so at various degrees of skill. There are people that cannot do sexing, people that just can do preg checks and not sexing, not other stuff. But it requires training in general and veterinarian services, which can increase the cost if that's what you aim for. Requires this specialized equipment like the ultrasound that is a little bit expensive to buy and start, but it pays off over the years. So it, depending on your situation, on the technician's situation, it pays off or not. But it's a more dynamic technique. It gives you viability by detecting the heartbeat, the actual fetus. It can give you information like the sex, age, and many others. So it's a very dynamic type of technique. So moving forward with our indirect methods for pregnancy diagnostics. We have the first one would be return to estrus, like I said before. So we inseminate or breed the animals and observe for estrus. If they come back in heat, they're not pregnant. If they don't come back in heat, they are pregnant. That is like, it can happen every 21 days after the breeding. So then every 20 days, you're probably gonna have a cycle if this animal doesn't get pregnant. The problem, we have some problems because not necessarily the absence of estrus would mean a pregnancy. Because the animals can be in a different stage of the cycle. It could be cystic. It could be many other reasons. So we might not be being very accurate on this. It depends on heat detection skills. Like if you have a good technician, if somebody knows how to actually detect when a cow is in heat, that also requires a little bit of training of the people that are doing that. Availability, it requires people to be on the farm daily, observing the animals for heat. At least two or three times a day would be ideal. And it can be optimized by the use of aids like the patches or chalk or other automatic systems. And it depends on a very committed estrus detector. Look at this, for example, it's a person that is in the middle of the blizzard detecting estrus. So it relies a lot on the people's availability. But it's also a valid strategy that can be done. There are other factors to consider when considering estrus detection as a method of pregnancy detection. Diseases, cows that are sick, they're not gonna come back in heat. Does it mean that it's pregnant? No. Cows that have silent estrus, for example, dairy cows, they cannot express estrus as good as a beef cow. So if you have problems like that, if you have cows that are slightly crossbred with dairy, they might not show as much heat. Environmental stress, heat stress. A cow in heat stress like this one, they're not going to show heat. They're going to be in the shade. They're going to be resting. They're going to be tired, right? Social factors. You have different group of animals together. You have handling. If those animals are stressed out, they might not show heat. Here we have a picture of a project that we did recently. It's been raining a lot here in Brookings. So we had some pastures that were completely flooded. So look at those cows. Cows in a situation like that, they would avoid showing heat. We had an example as well during our synchronization protocols. We had pouring rain in one day. Absolutely, half of the cows did not show heat. They got pregnant though. We had a good pregnancy rate, but the cows did not show heat because the environment plays a role on their behavior as well. So that's might not going to be a good idea to rely only on that for pregnancy detection because those factors can affect. Another indirect method is a blood test. So progesterone is a hormone of pregnancy, and it can be detected on the milk and in the blood. And it can use in laboratory measures like radioimmunoassay or ELISA methods can detect that. So here you see this figure, after heat, progesterone goes up, and before the next heat, it goes down again if the cow is open. But if she's pregnant, it remains high. So this detection basically detects the non-decrease on progesterone concentration. So it is produced by the corpus luteum, that is an ovarian structure like that remains in the ovary during about 18 days of the cycle. So cows from day 7 to 16 after estrus, they will have a corpus luteum. They will be producing progesterone. So if you get cows in these stages to detect for use as detection for pregnancy, you might have a false positive. You might be detecting a cow that is just cycling. It's not very accurate because we have this confounding factor, but it can be used as a strategically method. For example, in dairy farms, it's been used a lot in automated milking parlors. Here we have an example of a cow on the figure A. You have a cow that is not pregnant and coming in heat constantly. The arrow means heat. So progesterone goes up, but then goes down because she's in heat. and as you go. In a cow that got pregnant, that didn't get pregnant, but then get pregnant, you have the progesterone going up. In a cow that got pregnant after first estrus, the progesterone just remains high. So knowing this factor, these automatic systems, they detect the progesterone concentration daily on the milk and give a flag for pregnancy alerts to the system so people can go and actually check with a secondary diagnostic tool. So it's a tool that can be used, is available, and potentially can be used in the future for beef cattle as well, in some sort of type of test. But it's interesting. Another blood test that can be used is based on the blood tests that we have for humans. For example, we detect the HCG in humans. So we go to the store and get an HCG test. It's going to detect this molecule that is produced by the human embryo and goes to the female system and tells the female that there is a baby in there. So they basically let the immune system of the female let her know. So then you detect this in the system. In cows, we do not have a system that detects directly the molecule that is produced. In the cows, what happens is during this time of elongation, when the embryo is getting bigger and attaching, the embryo produces a structure, a molecule called interferon tau. Interferon tau causes this immune reaction and let the cow know that she's pregnant and activate some genes in the circulating immune cells. So in the lab, we can go collect those immune cells and detect those genes to let us know if the cow is pregnant or not. It's a lot of work, I know, but this is another possibility that is mostly used in research at the time. So this interferon tau is produced by this elongated embryo that is growing. So it measures basically the females that are not open. So it doesn't tell you that this female is going to be pregnant until 30 because there can be losses in the process. But if you look at this graph over here, you see the pregnant cows have much higher than non-pregnant ones. So it's very useful for research, for example, but there's no commercial application yet. Is a potential tool to investigate pregnancy loss potentially, but that needs to be still developed. On the other hand, there is another blood factor that after all of this happens, after day 20, the embryo is already attaching to the uterus. So the cells that are attaching to the uterus, they produce something called pregnancy-associated glycoproteins. Those pregnancy-associated glycoproteins go to the circulation and they can be detected by blood test. So it's a family of 20 different proteins, and they all together, they can form this high concentration. So these PEGs, this conjunct of proteins, can be detected as early as 22 to 24 days of gestation. And as you can see on this graph over here, it remains high throughout the pregnancy. So basically, there are some commercial available tests for this specific factor. IDEX has the Alertis pregnancy test that can detect at 28 days with accuracy. The shoot side test can detect at 28 days too. And it's basically the same test, but you can do by the shoot. It takes like 15 minutes or 15 or 20 minutes. This one takes a couple hours and is a little bit cheaper than that, than the other one. But both are equally efficient on those 2 days. There's a Bioprine. Bioprine has a little bit different according to the category of cow. In heifers can detect up to starting from day 25 and in cows in 28. And this DG29 can detect both heifers and cows at day 28. So here's an example. Here's the IDEX high rapid visual test, how it looks like, which is the shoot side one. You basically, the ones that are blue are pregnant, the ones that are not are open. So it's simple like that. We have this alert is one that looks like this. So then you have a plethora of colors that can be detected. It needs to be done in the lab. This is the prior print, how it looks like. And in SDSU Diagnostics Lab, they offer this service. Here's a QR code that you can look at the website and check what are the prices, what is the timeline that they can give you. But I'll tell you, it's not immediate. It takes a few hours or even days to actually do the process. So it would require a little bit more time than a direct method, for example. But it's a great strategy if you don't have access to direct pregnancy checks. Potential issues with this technique is that it's detectable in maternal circulation after postpartum. So the PEGs, they remain high during pregnancy, and after the calf, it still remains high for for 100 days. So if you are detecting pregnancy early after calving, you might have a confounding factor on that. In addition to that, if the embryo dies at some point in this range, it will remain high for a while, which might give you a false positive, might tell you that this cow is pregnant when in reality the embryo already died. So it's a thing to be careful with. And lastly, we have the Doppler ultrasound. Doppler ultrasound is another indirect method. So it doesn't detect the pregnancy itself, but detects the blood flow in the corpus luteum. So like I said before, the corpus luteum is this structure in the ovary that looks like this one here. And it produces progesterone during pregnancy, but also during the estrous cycle. So in the middle of the estrous cycle, you have hyperprogesterone, then luteolysis occur, and this progesterone goes away. During pregnancy, it remains high. So knowing that, researchers developed this strategy where they go and look at the blood flow in the corpus luteum around this time where luteolysis should occur, around this time where this corpus luteum should die in an open cow. So if a cow is open, this corpus luteum dies around day 16, 17. Okay, and it takes a couple of days, 3-4 days to get a new estrus and the new CL get formed. So knowing that, people decided to go around day 20 and detect the blood flow, because blood flow estimates the viability of the CL. So if the CL doesn't have a blood flow, it means that it's dead, right? If it's alive, it has a lot of blood flow. So here you see in the A's and B's, you see high blood flow. So this CL is viable, very active, producing progesterone. This you have intermediate on C and D, and here you have in E and F, you have dead CLs. So these ones definitely not pregnant. These ones could be pregnant. These ones could be pregnant. Okay. The problem is you have a closed window. You have to do around day 20, otherwise you're gone. If you go too far, you have a new CL, and then you cannot detect if that is a pregnancy or not. If you go too early, you still have a viable CL, and luteolysis did not occur. So pregnant or not, you're not going to know. It's another problem is this false positive. So there's a lot of cows that have a valid CL, and they are considered pregnant when you do this analysis, but in reality, they're not. They just have a viable CL. This is a problem of this technique. It also requires more expensive and specialized technicians. So a person needs to be able to do this analysis, to actually evaluate the corpus luteum and do the color Doppler. And the Doppler, it has to have this machine called Doppler that is a little bit more expensive. So it requires a little bit more specialized service. And if you look at the data in literature, it's about 20% of these detections are false positives, which means that 20% of this are diagnosed pregnant, but they are actually not. They have viable CLs. This is an example of a false positive. This B is not pregnant. It was not pregnant, but it had a lot of blood flow. So, however, this technique, even though it has this high true false positive, when associated with other resync strategies such as you start putting a seeder on the day that you do the Doppler, you put a seeder on, then you can anticipate the breeding season and do another resync right away, and you can shorten your breeding season from 10 to 15 days. So it is very interesting, and it's being developed. It's not available everywhere, and it depends on availability of the farms, obviously, but is an interesting technique that can help you to optimize the synchronization if you want to go one step ahead. Just to finalize what we were talking about, facts to consider when you are choosing the pregnancy diagnostics. I forgot to put the reference here, but this is from the Georgia University, University of Georgia. They did this extension publication where they put this table together. Among the commercially available diagnostics methods, rectal palpation, ultrasound, you can compare here which days of pregnancy you can detect. Rectal palpation for 35 to 50 days, ultrasound after 28, blood test after 28 days. The gestational age, do you need gestational age? So if you need, you might consider the factors that are capable of detecting that. If you need sex determination, what is the level of your technician experience? You can also consider that, and also the price. And when do you want these results? If you have some time, if you don't need to know right away, you can use the tests, the blood tests. If you want to do right away, shoot side, you might consider the other ones. So the ideal pregnancy detection method should accurately identify both pregnancy and non-pregnant females in the herd. So you should be able to be highly sensitive and highly specific. So those are highly specific and sensitive, but depending on where you are with your needs, you might choose one versus another. Things to consider when you think about palpation ultrasonography. Do you have a veterinarian available close to you? Someone trained to do those things? This person has equipment. If you are one of those people, if you are a technician, do you have the money to invest in a costly equipment like that? There's also physically demanding. So you have to be able to palpate animals, use your strength. So this is a thing to consider. But you can have visualization of the fetus. You can have visualization of the pregnancy and immediate results. So what is more important to you? What do you have available? Facilities, you also require facilities for that. If you think about the PAGS test, the lab tests, it requires less skill. It comes with a manual you can do by the chute. It's not that expensive anymore. As you see in the previous table we had, it's about $3 to $10 depending when you are. However, you do not have immediate results. You're gonna have to wait a little bit to get it. You might need to do extra animal sorting. So you go through the chute, get blood samples from everyone, then you find out who's pregnant, then you have to sort who's pregnant, who's not. It only gives you pregnancy status. It just tells you yes or no, it's pregnant or not. Do you need more than that? If you don't, this might be a good option for you as well. So if you think about the timeline for those things to happen, after UAI, usually we recommend 15 days of waiting until you put the bulls, turn out the bulls. The earliest you can detect pregnancies is 30 days after the first AI. So here, at this 30 days, you will be able to distinguish which is pregnant, which is not, by using ultrasound, okay? Only at 45 days, you'll be able to detect pregnancy via palpation. And you're not going to be able to distinguish precisely which is AI, which is natural service. After 60 days to 90, you'll be able to do the fetal sexing. So looking at this timeline, what do you need? What is your need? What do you want to do in your farm? And that's when you decide which methods would be the best for you. Okay. With that, I finished my presentation today. We have here the contact information of myself, Robin Salverson and Taylor Grussing. They're both extension specialists, extension field specialists. They are specialized in reproduction as well, and we are available to, if you have any questions about methods, if you want to talk about your particular situation, please do not hesitate in contact us. We are here for that. Okay, thank you very much. Now open for questions.
Yeah, thanks, Jess, for providing some great information. I know this is really vital for where we're at in the year, kind of coming into a, preg checking season, especially for our spring calving herds. And so, yeah, we'll go ahead and go into our discussion portion of the webinar. Again, as a reminder, if you have any questions, please drop them into the chat or Q&A feature. I can go ahead and kick things off though with Jess, you kind of talked about there's some value in early pregnancy detection. And you've kind of touched a little bit about it, but when would be the ideal time frame for a producer to use early pregnancy detection, for as how many days post breeding would be good?
So just a recap, this table is very useful for that. If you look, this is a table from University of Georgia. Dr. Pedro Fontes is the first author of this paper. And he showed that different strategies have the how early detection can happen. In rectal palpation is usually recommended from 35 to 50 days earlier than it can be done, depending on the experience of the palpator. Most palpators do it around 40, which is the safest bet. Ultrasound as early as 28 days. With safety, I would go for 30 days with safety to be able to actually detect the pregnancy, detect the embryo. And blood test PEGs at 28 days, you can detect. So if depending on how much you need it, those would be the ideal moments to do the early detection. What I also like about this window, doing in the first 30 days, for example, what I like about that is that you put the bulls in 15 days after 30. So at 45 days, you turn the bulls in. So if you detect pregnancy 30 days after the first AI, you're not going to catch any bull breds. And then when you do the final preg check, 60 days later, you go and actually detect what is bull bred, and you confirm the pregnancies from the first time. So I really like this strategy because it gives you information on which ones are bull bred, which ones are AI. So this is my personal strategy for the farms that we attend here.
Jess, did you see the question that came in the Q&A? I can read it to you as well. I can read it here. So, says, congrats on your presentation. ISG and Doppler could be combined. How pregnancy diagnosis methods to improve accuracy? Or I think so. Could ISG and Doppler be combined to improve accuracy?
Yes, there are some studies that show that, including that study that I pulled a picture from, Pugliese data from 2016. They did a study that they look at the Doppler plus the ISGs, and they noticed that accurately the Doppler, if you have high ISGs, you're still gonna have a viable CL because that pregnancy was signalizing. The problem we have with that is that ISGs is an early detection. It's like after day 15, ISGs are already high, but this embryo might not survive. So if this embryo does not survive after let's say day 20, from 20 to 30, which a lot of pregnancy loss happened during this time, you're still going to have a positive for ISGs and still going to have a positive for Doppler, but you're not going to have a pregnancy confirmed that's going to go to term. Does that make sense? So like this pregnancy might be lost and you detect it. You're telling today on day 15, this cow is pregnant. But let's say this cow loses the pregnancy on day 18. You're still going to have a pregnancy on day 15, but day 18, they're not pregnant anymore. So you run into this issue of not having a long-term diagnostics. So that's the issue. I really hope more technology is invested, more time is invested on getting those tests to be more accurate, or shoot side. Another thing with the ISGs is that the ISGs need to be done in the lab, and it takes about a day to do. So you have, at this moment, we do not have any, at least to my knowledge, there's no test available to be done in the farm by shoot side, or like available commercially. So it would be a hassle to combine both, other than in research setting.
I guess one last question I kind of have is, other than say, yourself, I guess, who would be some other good folks to contact if, if producers are considering, maybe they haven't used pregnancy detection before? Who would be some good folks to contact about this and what methods to use?
We have Taylor and Robin. They have good contact information for the different regions. I also have some information around here, who can do that in this East River here around Brookings. But Robin and Taylor also, they are in different regional extension centers. They do have people that can be contacted to do that. But also we offer the link in the chat, and there's the QR code in the presentation of the SDSU diagnostics lab that does those preg checks by blood testing. I'm not sure the turnaround. I think the turnaround is at least a couple of days, but and it's not that expensive. I believe it's $3 per sample, if I'm not wrong. But if you, let's say, I always use this example, blood testing is always good when your veterinarian cannot come. So you have, let's say you have scheduled for your vet to show up and preg check your cows in a day, and there's a tornado on that day. So you do not expect your vet to show up, and let's say his agenda is full. So you have to have your cows checked somehow. So the preg checks by blood is a great strategy in that sense. Or you live in a place that veterinarians are not around, so you might have to use those strategies as well. So SDSU Diagnostics Lab also ship, so you can ship samples to here too, I think. So the information is in the website. And if anybody needs any other information, please do not hesitate and contact us.
Great. Well, I think we'll go ahead and wrap things up here. If you do have any more questions for Dr. Drum, please feel free to contact her directly. Her information should have been dropped in the chat. As well as then be sure to check out the SDSU Extension website for our upcoming Cattle HQ Live events. We do have a brief survey that will be sent out at the end of this that we ask you guys to fill out so we can continue to improve our webinar series. Thanks again to those who have joined us today and for taking the time out of your schedules to be with us and listen in. We'll see you next month.